one. It's been hearing how children living with long COVID here were dismissed and ignored by the people supposed to protect and support them. Those are some of the claims. Well, Helen Goss from charity Long COVID Kids has been giving evidence today. She's with us now. Helen, good to have you with us. What points did you cover in the Scottish inquiry this afternoon?
Hi, Fiona. It's good to be here. Oh gosh, we covered so much. We covered how it's so difficult to access healthcare still. Families who are joining long COVID kids support services in 2023 are still facing the same struggles as we were in 2020. So we discussed that a lot. We also discussed access to social care, which, as we know, is under immense pressure, and actually no one has been able to access social care except us in a Long COVID Scotland group. I can't remember what else we discussed. Honestly, I'm so tired now after that.
Yes,
my brain is empty.
It must have taken it out of you. Remind us, if you would, in the audience, of your particular situation, Helen.
So we were in the first wave when we got COVID for the first time in March 2020. My daughter was heavily impacted. She's had 2 further infections of COVID-19, and each one has made her much worse. In fact, she's still asleep now. She slept through the whole inquiry evidence this afternoon. She's pretty much bedbound, and COVID has done this to her. And actually, one of the other things we spoke about is the public health messaging being so poor and actually absent, that nobody knows that you can develop long COVID with any infection. So, I'd really urge parents to avoid COVID-19 infection for their children as much as possible.
And Helen, you giving evidence this afternoon, you said you were dismissed and ignored by those supposed to protect and support you. Why do you feel that, if you wouldn't mind explaining that?
Mm-hmm. Yeah, of course. I mean, we've had so many meetings with the then Health Secretary when Hamza Youssef was Health Secretary. We've had roundtables, we've had meetings with the NHS, and we've talked ourselves blue in the face about, long COVID in children and what they need, what support they need, what treatments they need for a better quality of life. But it's still not there. It's still not there, and I'm not sure what more we can do to get some action on this. It is glacial. And there's no progress.
What do you make of the claims that senior figures, including the First Minister's predecessor, Nicola Sturgeon, have been accused of erasing WhatsApp messages that are being requested by the UK COVID inquiry? What do you make of that?
It's very convenient, isn't it? I think, from what we've heard from the UK inquiry so far, I'm not surprised that messages have been deleted. I don't think I'd want that evidence shown either. It will be interesting to see. I mean, I'm not sure if it's confirmed yet if they have been deleted. I'm not sure if it's allegedly deleted. We'll have to wait and see.
What do you want to come out of the UK and the Scottish inquiries, Helen?
I want to know what on earth went wrong. Why on earth are we in this situation? I did not see my life panning out this way. I don't think any of us did, whose kids are now, disabled from COVID infection. I want to know the truth. I want there to be accountability for the very poor decisions that were made. And I need change. We need change right now, because there are kids who are suffering every single day. They're not getting any help, and there will be more kids in the future.
Do you think there is still a degree of stigma around long COVID, Helen?
There is. I think it's getting a bit better. But again, the stigma only exists because the education isn't there. And again, that is down to very slow progress from the Scottish government. They really need to fund clinics appropriately, get the clinics up and running for a start. There are none for paediatrics at the moment. I believe very few for adults. And we need to educate everybody on how bad it can be. It can destroy your life.
Do you think that medical staff understand long COVID?
Some do, most don't. for example, we actually have given up trying to get support from NHS Grampian now. There's just no point in carrying on. So we are having to stick with private healthcare because they are long COVID experts. And
so you're paying for treatment?
Yeah, we are paying for treatment and it's incredibly expensive, but there literally isn't any choice. And there are families out there in Scotland who do not have the money to be able to fund treatment like that. I recognise my own privilege here. And what are the families on low income supposed to do? They can't afford to go private.
And Helen, we were hearing earlier today from the UK COVID inquiry, it may actually have been when you were giving evidence, the Scottish one, but we heard the former Health Secretary, Matt Hancock, wanted to decide, and I quote, who should live and die if the NHS was overwhelmed. That was some evidence given by the former boss of the NHS down in England. What do you feel when you hear that?
Yeah, I think I was giving evidence. That's the first I've heard of it. I mean, goodness me, does he think he can play God? That's insane. Nobody should have the right to decide who lives or dies. That's crazy.
Well, that was the former Health Secretary for England, of course, Matt Hancock. And Helen, when you look to the future for you and your daughter, what do you think that holds? What hope do you have, I suppose, of getting back to whatever normal is?
Well, to get back to normal, we're going to need to have a safe world for us to get back to normal to. Every reinfection that she gets worse. So, and, going to the hospital for any healthcare appointments, which we're not doing now because we've given up on it, it's the most dangerous place for her to be. There are no mitigations anymore. Nobody's wearing masks. It's an airborne virus and nobody seems to care anymore. So I have hope for her recovery. I really do. I have to hold on to that. But as for the future, I have absolutely no idea.
Helen, thank you so much for joining us tonight. It's much appreciated. That's Helen Goss there from charity Long COVID Kids.